project is built out of something that in Alberta Health Services screening programs, we had already started to work on, a project called Creating Health Equity in Cancer Screening, which we lovingly call CHECS. This project started a long time ago where we were seeking to understand differences in cancer screening participation rates. And when the opportunity presented from CPAC to have a grant for meaningful community engagement, we really thought that this was a great fit with what we were trying to do within the CHECS project. We wanted to focus on all three cancer screening programs that we have within Alberta Health Services, including breast, cervical, and colorectal. And so we really focused our engagement on trying to understand from people what their intentions were towards screening, what helps motivate them to go for screening, and what their awareness would be.
The main groups that we were trying to reach within this project were community members living in the east and northeast areas of Calgary. And we chose these groups based on a previously completed data analysis that reported that those areas of Calgary experience higher levels of material deprivation and they experience lower cancer screening rates.
We knew that community organizations were already working with a lot of the target population that we were trying to reach with this particular engagement. And we wanted to build off of that work that they had already done and the relationships that they had already forged with the community members. So we really felt it was important that if we could build trust through our partners, that we could then build trust with the community members.
So we worked with multiple different partner groups in order to reach our target audience. And the partners were really integral to this work and provided support in multiple different ways. They helped with recruitment and planning and the execution of the community member focus groups, as well as the health worker interviews. They translated recruitment materials for us. They actually participated in the health worker interviews. They provided live interpretation during the focus groups. They translated and completed post-focus group surveys with community members. And really, ultimately, they help to co-design the outreach strategy by providing their community level expertise for us. Our partner organizations really help to put into context a lot of the findings that we found from the focus groups and the health worker interviews. They had that community level expertise, and they were able to kind of provide that insider knowledge and help us to more closely understand what some of the participants in the focus groups were saying and to make sure that our outreach strategy closely mirrored what we heard in that engagement. One of the key partners that we worked with were the Alberta International Medical Graduates Association, and we engaged with them as a way to kind of bridge the gap between the healthcare system and the community. And they were really integral to understanding the community side of things, but also that health system side of things. The COVID-19 pandemic caused us to pivot our initial project and really to be adaptable as much as we possibly could. With support from the One World team, we created a new engagement plan that we wanted to use kind of to pivot to that online engagement form. And then we actually created a backup plan to that backup plan. So we pivoted our in-person engagement to be online. So our virtual focus groups and interviews were held via Zoom. And then our backup plan was to disseminate a broader survey instead of those online focus groups. And we took great care to make sure that participants knew how to use Zoom. We created a Zoom cheat sheet. We offered telephone phone-in options for those who preferred to call in rather than to log into Zoom. And we strongly encouraged the use of the chat box, which actually seemed to be a preference for a lot of participants as it was easier to use. The pandemic created some new opportunities for us. Mostly we learned about the flexibility, or we had flexibility of kind of when to host focus groups and interviews. We could host them on evenings and weekends with a little bit greater ease. It reduced costs on obviously things like booking in-person rooms and so on. And we also increased the accessibility as people could participate within the focus groups within the comfort of their own homes. A lot of the community organizations that we were reaching out to assist us with this work had many competing priorities. So that was definitely a challenge. But I would say that there was still strong interest in supporting this work despite the pandemic. We just really had to make things as easy as possible for the organizations and really provide as much support as we possibly could.
the other main challenges that we really faced in our project was trying to ensure that we got representation from community members, a broad representation, ensure we heard from people that maybe don't speak up or people who were experiencing barriers to cancer screening. We really wanted to try to eliminate where we could that bias or selection bias from our focus groups. And so one of the things we hadn't initially thought about was translation.
We had translation of the recruitment materials done, and that was really necessary to make sure that we had access to the non-English first language community members within the East and Northeast areas of Calgary. We also provided live interpretation during the focus groups, which was really necessary to ensure that community members understood the questions and that they were really able to respond in their first language.
It became very clear to us as we started to recruit for our focus groups that having different languages on a recruitment poster were important, or offering the focus group sessions in different languages was important. And we really were enabled by our partners to be able to do a lot of that.
It also allowed for underserved communities to be heard.
So we did make many new and improved relationships with organizations in Northeast and East Calgary. And I think that in the future, this will help us to create that trust for the healthcare system, in addition to cancer screening.
Another main learning that we took from the engagement work was that participants were very grateful to be engaged with. They were grateful to be given an opportunity to learn about the healthcare system, about cancer and cancer screening, even just within the focus groups. They really appreciated being able to freely ask questions and to inquire more about the healthcare system from a trusted health professional that was facilitating the focus groups.
After we did the engagement component of this project, what became really clear to us is that it didn't stop there. Our engagement didn't stop there. And so we actually created ongoing relationships with many of the health workers who had informed our interviews in building a co-design working group so that we could bring forward to them ideas about what we were doing, show them different prototypes, examples, samples of what we were doing so that they could provide their input into how this would actually work for their communities or people within their communities, how they as an organization could support it as well. And so really it was that continuous co-design that was so important to this project.
Another main learning was that there are very key differences in the healthcare system between different countries, and there is kind of a lack of understanding of preventative medicine by some community members or some new Canadians that are living within these areas of Calgary. So the health worker interviews really brought to light the different healthcare systems that many new Canadians are coming from. And we really had to tailor the focus group guide after a few different focus groups to include more preliminary information around how the healthcare system functions here in Alberta and more broadly in Canada, and to make sure that it was very clear the purpose of this focus group and the purpose of the work that we're doing here. And lastly, one of the main findings is that meaningful virtual engagement really can be done. We learned that it takes time to ensure that participants know how to actively participate in online engagement. But if you allot time at the beginning to troubleshoot any technology issues and to really set the stage on who you are and why this work is important, that it really goes a long way. So we really took all of these main findings from the engagement work to heart, and we created an outreach strategy or an intervention that we wanted to go back into the communities and implement that was really aimed at increasing awareness and understanding and ultimately participation in cancer screening.
We have taken a very targeted approach in working with particular communities in a particular geographic area. We really want to think about how do we spread this approach to more communities throughout the province. And so we always kept that in the back of our mind as we developed our outreach strategy and thinking about the resources that we've developed, the videos that we have, the social media ads, and how they can be used in many other communities throughout the province.
We knew that it needed to be multi-component, that it needed to have different aspects to it that catered to the public. And we also knew, based on the engagement, that it really needed to target not just the public, but also health workers. So the outreach strategy or intervention that we created kind of has three components to it. So the first component is a variety of cancer screening awareness videos. So we created 7 animated cancer screening videos that touch on how to screen for cancer and who should screen for cancer within breast, cervical, and colorectal cancer. The second component to our intervention is the social media campaign that really works with community organizations to promote those cancer screening awareness building videos. And then the third component of the outreach strategy intervention is the community education sessions that we're hosting, where we're really hoping to host education kind of by the community for the community, where we're using those partnerships that we've made throughout the engagement process of this work to leverage their existing audience members and to host some sessions around cancer screening.
So further to the outreach strategy that Selena just talked about, a big component to us that we're thinking about is, have we met the mark? How will this multifaceted outreach strategy be received by the different community members that we're working on? And so we will do an evaluation to see how this has been received and whether we have accomplished our goals.
So one recommendation that we have for others who wish to engage with similar target groups in cancer screening is really the importance of relationship building. So really emphasizing that this is a lot of work and having to put in the work to foster those relationships with partners and partner organizations, as well as other community champions who are already doing similar work and can sort of act as that liaison between the healthcare system and the target groups. And really making sure that we provide support and make it easy for those partners to participate in this work. And really, these partnerships are really essential to bridging that health equity gap in cancer screening.
What we hope to be able to do with this project is scale and spread that. And so many of the resources that we have developed, we hope will benefit other communities in the province. And what I really do hope is that we can weave what we've learned from this project into the fabric of cancer screening programs and really help to work with different communities to have a targeted approach to building their awareness and motivation for the benefits of cancer screening.